In fact, just 5 years in, the Affordable Care Act has already helped improve the quality of health care across the board. A lot of the attention has been rightly focused on people's access to care. And that obviously was a huge motivator for us passing the Affordable Care Act, making sure that people who didn't have health insurance had the security of health insurance. But what was also a central notion in the Affordable Care Act was we had an inefficient system with a lot of waste that didn't always deliver the kind of quality that was needed, that often put healthcare providers in a box where they wanted to do better for their patients, but financial incentives were skewed the other way. And so the work that we've been able to do is already spurring the kinds of changes that we had hoped for. So making sure that the Affordable Care Act works as intended to not only deliver access to care, but also to improve the quality of care and the costs of care, that's something that requires all of us to work together. That's part of what the law is all about. It's making health care coverage more affordable and more effective for all of us. And in a lot of ways, it's working better than many of us, including me, anticipated. But the bottom line is this for the American people. The Affordable Care Act, this law, is saving money for families and for businesses. This law is also saving lives. Lives that touch all of us. It's working despite countless attempts to repeal, undermine, defund, and defame this law. I mean, we have been promised a lot of things these past 5 years that didn't turn out to be the case. Death panels, doom, a serious alternative from Republicans in Congress.